Welcome back. It's 6:22. It's called the silent killer. High blood pressure or hypertension is a major risk factor in heart attacks, stroke, and chronic heart failure, according to the CDC. Most people can control blood pressure through diet, exercise, and medication, but for 1 in 5 adults, those three things just won't do enough. A new experimental treatment could give hope to those suffering from resistant hypertension.
Worked for a while, and then they just quit working.
For years, Betty Caswell struggled with high blood pressure.
It started out at 230/120, and then it came down.
She has what's known as resistant hypertension. Even with her own medical background working as a vascular tech, lowering her blood pressure hasn't been easy. To control it, Caswell needs 6 different daily medications.
It's estimated that as many as 20% of patients with hypertension have resistant hypertension, meaning that they're not able to be controlled with 3 medications.
For these patients, it's not just a matter of diet and exercise.
The communication between the brain and the kidney in patients with hypertension is dysfunctional or overactive, causing the kidneys to drive the blood pressure within the body to levels that are above normal.
Caswell worked with Dr. Khuddus to find the right combination of drugs to manage her condition, but each one brings with it new side effects.
One of them can cause nausea, one, cause dry mouth. That part was frustrating.
A new treatment in clinical trials called renal denervation may change that.
Renal denervation ultimately blocks the signals that go from the brain to the kidney by disrupting the nerves that course within the renal artery. That's done by emitting radiofrequency energy, either through the use of catheters or balloons that are placed within the renal artery.
The treatment is designed to help supplement existing blood pressure medications, so ideally patients could decrease the amount of medication they need to take. However, this emerging technology hasn't come without bumps in the road. Last month, in the largest clinical trial to date, scientists found that while the treatments posed no safety concerns, it was not as effective as they expected it to be. These results may slow the pace of other trials in the works planning to test slightly different variations of renal denervation technology. In the meantime, patients like Caswell turn to facilities like the Cardiac and Vascular Institute's Hypertension Clinic. There, board-certified hypertension specialists review all aspects of a patient's health to rule out any underlying causes of hypertension, like thyroid problems or sleep apnea.
If you keep throwing meds at them and they're not responding, there may be something else that we're missing, and so that's what the hypertension clinic is designed to do.
It's a comprehensive approach to treating blood pressure while we wait for new technology to bring new options.
Renal denervation, to me, is one of the most exciting developments in cardiovascular medicine in recent years, just because these patients have had so few options with regard to treatment of their hypertension, and clearly this represents not only a new option but a different technique and a different approach to the treatment of these patients.
North Florida Regional Medical Center and the Cardiac and Vascular Institute plan to participate in the first nationwide clinical trial once enrollment for that trial begins. Caswell says if she's given the option to enroll in the trial, it's something she would gladly be a part of.